Okay, Jean. Okay. Let me make sure I sound okay?
Yeah, you sound great.
Okay. Oh, thank you. Great. I like great.
All right. I'm just waiting for Leah to hop on here. Oh, there should be an invitation, Leah, on. Jean, how does it show on your phone whenever we add you to the live?
It said West invited you to join. It should pop
Is
up.
that when you're already in the live or outside of it?
No, you just log into your account.
Okay, let's see here.
I hope this works with a three-way.
Whenever I was doing some research online on it, it said that we could have up to 3 people on.
Okay.
Always see you, Leah.
Leah's first time on Instagram Live.
Mm-hmm.
I wonder, I don't know if it'll help for me to if I hang up and then she joins first. I don't know.
Hmm. Hi there, Leah.
Hello.
You did it!
I've done it before. I've just never done it with other people.
Well,
So
welcome.
thank you. Thank you. How are you ladies doing?
Hello,
You're
hello.
great.
We are great. We've been looking forward to this.
Fantastic.
Yes. There we go. Okay. So I know Well, this is your first time with us, Leah, and we're so happy to have you.
Yeah, happy to
My
be
name
here.
is Bailey. I'm the therapy coordinator with Westview and Tanglewood Pediatric Dentistry. And typically once a month, Jean, our speech therapist that's in-house, and I will get on and talk about a topic that's burning in our brains or deep in our hearts. But this month we've been honored by Leah coming on and talking a bit about something that is kind of in both of y'all's wheelhouses of infant feeding, and how y'all's approaches, one being speech therapy, one being IBCLC, is so different, but also is so much the same. So I'll let y'all take it away and introduce yourselves.
Okay.
You go first,
Sure.
Leah.
My name is Leah Whitley. I am the owner and founder of SOS Lactation. I've been a board certified lactation consultant for over a decade. I've had my private practice for about 9 years, and that's a little bit about me. So I do all things boobs, babies, breastfeeding, feeding. That's kind of what I do.
And I am Jean Hawley. I'm a speech language pathologist. I am the owner of Little Eaters and Talkers. We provide feeding, speech, and occupational therapy in the Houston area and virtually. We have an office space in Bel Air. And I work out of Westview Pediatric Dentistry 1 day a week as well. And I treat 0 to call it maybe 5 or 6 years of age, unless if you are an older kid with swallowing disorder, then I also treat that too. But yeah, and Leah and I often collaborate and are always picking each other's brains. And so I think it's really important for people to know what's like we have so many burning questions, right, Bailey,
Yeah. Yes.
for what often comes up, even for you as the therapy coordinator.
Yeah. Because I mean, when families call in, it's rare that you guys are at the front desk ready to answer questions, and so a lot of times those questions do get geared over to me. I know majority of questions that families have, anyone that's within our practice can answer those questions perfectly. There are some that might be a little more specialized in a certain direction or one way or another that do get sent over to me, but we love having the wealth of knowledge that you guys give us.
Awesome.
Um, so we did get quite a few questions on the difference between lactation and speech and how that can help in that early year for a lot of families. And then I know I had a couple that were really just my little insights that I like to know a little more about each of y'all. Um, what has been y'all's favorite part about working with babies and their families?
You want to go first, Jean?
No, you go first, because I feel like, a lot of times, Leah, you're like the first step of a feeding journey, and it's so special. So I feel like start from the beginning.
Okay. And so, Bailey, repeat the question again. You said,
Yeah. What has been your favorite part about working with babies and their families?
oh, I love babies. They're so cute and squishy and adorable. And I'm really honored when new parents welcome me in to such a vulnerable space when they're in such a big transition and a space of, kind of finding a new equilibrium, bringing this new person into their family. So my favorite part about it is giving parents the confidence to kind of know what they want to do and giving them permission to kind of and the tools they need to raise and feed their babies the way that they see fit. But yeah, whenever I go into a place, I like it when families tell me that they feel a lot more comfortable when I left. Like, oh, after we saw you, we felt so much better. We had such a sense of relief, or it really gave us, the confidence that we needed to get through the day and do the things that we needed to do with our little ones. So those are kind of the most rewarding things that I hear from families.
Yeah.
Um, I'd say, to build off of that, More often than not, I'm seeing a baby or a child who's having more than your run of the mill feeding difficulties. You know, things have been tried, they've seen other therapists and things have not worked. And so I really thrive in those like more problem solving environments where I can teach parents and caregivers how to gain their control back and
Hmm.
turn feeding into a connection and enjoyable process, which is for the rest of their child's life. And
Yeah.
it's a family event. It's a family affair, right?
Hmm.
So yeah, when we can stop like feeling like it's a battle or the challenges and gaining, just like Leah said, that confidence, but also I deeply encourage parents to advocate for themselves and for their babies and try to teach that from the beginning as well and to ask questions. But yeah,
Yeah.
once when that is like moving in the right direction, that's the best. That for me is like the best part.
Hmm.
Sorry for
What
the
is a
barking.
way, right? What is a way that y'all collaborate on patient care together?
Go ahead,
All
Jean.
right. Okay, so how do we work together? So, you know, Leah and I have similarities, we have differences. Sometimes we kind of like talk about how we do things the same and how we would do something different. Of
Mhm.
course, when Leah's seeing a baby, if I see the baby, it could be a totally different story, a different time of the day, a different part of the feeding journey.
Hmm.
But I would say for me, in particular, you know, I'm looking at the baby as a whole, right? I'm looking at the feeding function of the baby and the experience perspective. As an SLP, I'm looking at, of course, the oral motor skills. I have a lot of foundations in gastrointestinal health and
Hmm.
nutrition, and so I really look at like the whole big picture and how the feeding journey is going. And then in addition, you know, if I'm doing a breastfeeding eval, I'm looking at of course how is the latch on the breast, but also the milk transfer, the mechanics of breastfeeding. I also will look at bottle feeding mechanics as well, and then that baby parent feeding relationship. So
Yeah. I
yeah.
do feel like we see like some of the same people, but like at different stages, what you were saying, Jean. And sometimes I feel like people don't understand that developmentally as babies change, their patterns can change in terms of how they're feeding, what those oral mechanics look like. There might be certain compensations that they're doing when they're younger that as they get bigger aren't really flying at it through a different lens or putting some different kind of interventions in there than what you had done previously. But I'm glad that you did mention that because sometimes I think families forget. They'll say, well, why was this working before when he was 2 weeks? And now that we're 4 or 5 months old, you know, it's not working anymore. And it's like, oh, the situation's completely different. We've gone from 2 weeks to 4 or 5 months. And, you know, we have a completely different baby and scenario now.
Yeah.
Absolutely. Yeah. So when I see quite a few patients, they're like, oh, I saw Leah and how much she helped me in that journey. But then so many changes happen. And there are times where I'm like, well, you should go back to Leah. I'm sure Leah would
And
love to see your baby now
sometimes
that they're
she
bigger.
And sometimes, Sheen, I feel like we talk about that too because you'll say, "Oh, I'm seeing such and such," and I'll fill you in on like way back when, like, "Oh, when I saw them at this stage, this is what I was noticing," to kind of help you fill in some of the gaps and maybe better ascertain exactly where they are at that moment that they're seeing you. But yeah,
Yeah. But I would say, like, for me, I do tend to focus and specialize more on bottle feeding. And I do love breastfeeding, but and I love troubleshooting complex breastfeeding and
Hmm.
breastfeeding with babies who have swallowing issues. That's a huge component of what I do. But that beginning journey of breastfeeding, I am always like, call Leah. Call Leah. She is going to be your number one support system. And then, you know, if challenges happen later down the road, of course, Leah is available to help. And then, and that's kind of when I like to get involved as well.
And anything swallow related, I would say, Jean, because like with breastfeeding, you're kind of looking at the diet, you're looking at how the baby is feeding, how they're sucking. You're going to be checking transferring and oral motor skills. But if you start really seeing some swallow dysfunction, I feel like that's way more SLP, you know, stuff. But
But it doesn't always pop up in that first two
it
weeks.
doesn't. It
It
doesn't. It
often pops
doesn't.
up a little bit
Mhm.
later, and you go to your 2 month pediatrician appointment, and your pediatrician says, I think you should see a speech pathologist at this time, right?
Mhm.
Go in that
Right.
direction, get the different perspective, because Leah knows this better than, well, we both know this. An IBCLC has a lot different, can have a lot different trainings. It could be a nurse. It could be someone who just decided to become a lactation consultant, right? So the medical training varies, and you worked at the hospital previously, didn't you?
Yeah. Yeah, I've worked in a lot of different settings, but yeah, uh, as IBCLCs, I think it's the same as like a lot of professions. It's like you get your formal training when you're becoming board certified, but a lot of people are coming from different backgrounds and different perspectives that they can integrate into what it is that they're doing, and it's going to kind of affect or impact how they deal, you know, uh, with the family that they're working with. So not every IBCLC is going to come at it the exact same way. I'm sure you could say the same thing, Jean. Like
Absolutely.
just because you're an SLP, it doesn't mean that you can take any newborn baby to any
Nope.
SLP, and they're absolutely not. Everyone
Mhm.
kind of has their different niche. They have their different background, kind of their different specialty and their bread and butter, and that's going to largely impact how they approach things and who it is that they see and how they can help.
Which is why even like as us as a team, I encourage parents, do your background check, right? Like, don't just choose anybody to see your baby. This is your baby. Like, make sure that person knows what they're doing. It's really important to help you get off on the right step, right from the
Yeah.
beginning.
Yeah, no, it's true. I feel so bad for parents because they already have so many things that they're trying to navigate. I remember when I was a new mom, just being completely overloaded by just even the appearance of a breast pump. I found it so intimidating. So, but I think that goes into like what you were saying, Jean, kind of doing your homework. It's really nice when you can take a little bit of time, even before the baby is born, where you have a little bit of a clearer headspace to start to look into some of these things and figure out, okay, who might be some good people to have on my care team, or asking friends and family that have maybe been in similar situations what their experience was, with other providers that they worked with, to kind of, yeah, see who might be a good fit for you.
Exactly.
Well, you guys answered the second part of the question of why it's important to have families work with both of y'all when they have a certain type of concern. Um, what are some of the more common signs or red flags that a family can see that would indicate that they might need some feeding support?
I think every mom who wants to breastfeed from the day before they leave the hospital should have an appointment with Leah.
Jean, I really feel like there are some things that are just, I wish everyone had. And when it comes to like help, professional help with feeding, I feel really strongly about that. I agree with that because it's very difficult being a new parent. And a lot of times, people think, oh, it's going to be easy. But like, especially in our culture, how many small newborns do you actually see feed? It's not like we're coming from a culture where you have a little bit of learned experience just from observation. So having someone there that can help you navigate is just, you know, I think it's priceless. I agree, Jean, that everyone should have some kind of help or support.
I mean, I've read, I always hear about stories and I've read articles where, in other countries, why is breastfeeding more successful early on? And it's like, well, you've got your community. You've got your grandma that lives in the house. You've got your aunt that lives next door. And here in our culture, like more people are often spread out and don't have as much of that early on help. And I mean, even when you talked about being a first time mom. Oh my God. I thought I knew so much, but I still needed I still needed an IBCLC. And I even had one on call and I went to one multiple times and I was a lactation consultant at the time. So that doesn't mean like I needed someone else's lens to look and make sure I was doing it right and provide even that emotional support as a new mother that I had no clue what I was doing, even though I thought I did.
I
Right. So
remember thinking, even when I was pregnant with my third, okay, I've got this many more clinical hours. I suffered through that I had to take one day at a time that first 2 weeks, the same way that I did with all the other babies. It's really different when you're in that place yourself and you have your own baby, like even coming in as a professional, like you said. And you probably get that a lot too, Jean, because I'm like right here in the medical center. So a lot of my moms are providers, they kind of work in the medical field or they do work with babies in some kind of way, but it's really different when you have your own baby. I remember when I was getting a lot of my clinical hours from one of the hospitals, and it was a very diverse hospital that had a lot of people coming in. And sometimes I would get moms that I would assume were not first time moms. I would assume that they were second, third, fourth time moms because when I would come in, they already knew how to hand express, they already knew how to massage their breasts. They knew some basic positioning. And a lot of times they were first time moms, but they're coming from countries or places where seeing women breastfeed is the norm. They've had the benefit of being able to see women in that experience and how they handle things, and we know even when it comes to latching, a lot of it is on the job training, but when you see images of it over and over and over again, the likelihood of you being able to replicate that on your own is much higher. So yeah, there is something to be said for that.
So, like back to your question, Bailey, with common signs, I feel like if a mother has, the foundations that Leah as an IBCLC would provide from the early start, they're hopefully reducing some of the overwhelming feelings that just
Hmm.
come with being a new mom.
Yeah.
But like for me, oftentimes I'll get my consults are like feedings are taking a very long time, 45, 60 minutes, whether it's with the bottle or the breast. Um, you know, the, I hear a lot of, the baby falling asleep on the breast, right?
Hmm.
Arching, pulling away, those kind of early GI symptoms of like something's not feeling right and it's making
Hmm.
feeding really stressful. Coughing, choking, gagging with feeds is another one. A lot of leaking of milk, not necessarily with breastfeeding. It's more the calls for me is like with bottle feeding, that milk's constantly getting spilled. Clicking sounds. I'm sure Leah gets that one, whether it's the breast or the bottle, and trying to figure out
Hmm.
what are the causes of that one. Another top one that my consults are, or that red flag, sorry, is poor weight gain. Um, that's one that I usually get a lot of consults on. And then, just really stressful feeding,
I I
you
would
know.
say if a mom is ever in a situation where you're wondering if you can actually pull yourself together to do another feeding session, then we should have already had a time to meet. So if you're in so much pain or if you're having so much distress that you're kind of like, oh my God, I've got to feed again. Can I even get through this? I would say, oh, we should have met. We need to kind of get together.
Yeah.
But back to what you said, Jean, I think one of the good signs to look out for is just in the infant feeding patterns. When you have babies that are taking a long time to feed, or those feeds are very short, they're falling asleep very quickly before they're on there long enough for a complete feed. Babies that have very high feeding frequency or very low feeding frequency. When you find babies that are kind of on the outskirts of the norm, on the far edge of the pendulum, usually that means that something needs to be a little bit better. So that's when I would tell parents, okay, definitely, or if you're in extreme pain, for sure. But
Hmm.
those, along with the other symptoms Jean was saying, are good reasons to have a consultation.
And sometimes it's, as Lisa said, sometimes it's more than one consultation. Oftentimes it should be more than one, because I don't think people understand that when I'm first meeting a baby and a caregiver and the dyad in that first visit, which is often an hour and a half, and then I'm following up by texting or calling. I can get enough information to make a game plan, but that doesn't mean we might not have to change some things along the way.
Hmm.
That might not mean that I was successful in my thought process, right?
Right.
I
Well,
do my
some of it is
best.
well, you're taking the information that they're giving you, but some of it you're trying to fill in the blanks of what you're anticipating is going to happen. And you can never fully anticipate everything. So even if you come up with a plan that looks really good, even if the parent is reporting that, oh my gosh, all the things you did really worked, I still want to follow up and make sure that we're crossing our T's and dotting our I's and the baby is
Yeah.
demonstrated that everything really is good, because it's one thing to feel that way as a parent, which is wonderful, but it's also another thing as a professional to go in and see that the baby is demonstrated that everything is solid. So ideally, even in a really good case scenario, I would say follow up just to make sure is ideal.
And that is like a lot of times, I don't know if you see this, Leah, in with the parents that you see that, but sometimes I'll do an eval and I'm like, okay, we probably need to do a follow up in XYZ time. And some parents don't realize that added benefit of the follow up.
It's true. And sometimes you'll see them following up later, and it's
Hmm.
like, oh, because they're thinking things are working, but then slowly some things kind of start to fall apart. But early
They creep
intervention
back
is
up.
always, exactly. Early intervention is always much easier for families to navigate. So the sooner Jean can see you, the sooner that I can see you and iron out those kinks, usually the less work that family is going to have to put into it.
Yeah, I agree. I know the consistency is important. That's
Mhm.
yeah, I would like to definitely encourage parents to kind of like, it's a little bit of the buy-in, of
Hmm.
knowing like we're here to help. We are both knowledgeable people in what we do, and we just want the best for your family, your baby, and the caregivers.
For sure.
Mhm.
For sure.
I don't know if you're like me, Leah, but I'm always checking in on my babies.
Oh,
Even if they don't
yeah.
ask
Yeah.
me. I'm like,
Oh,
oh, how are you
yeah.
doing? Send me an update. I
No,
miss you.
definitely. Definitely, definitely. And you have those little times where you're just out and about and certain scenarios pop into your head and you're like, okay, let me just make sure. How is this mom doing? How is this baby doing? You really just want to make sure that everything is okay. I feel like in our line of work, Jean, we're probably very fortunate where, I mean, I absolutely love what I do. I know you love what you do too. So you really do want to see that everything is working well. I can honestly say if I were to be put out of business, I would happily find something else to do, because if the world could just be filled with nothing but moms and babies that were feeding perfectly, nothing would make me nothing would make me happier than that. So yeah, you really want to make sure everything is good.
Hmm. For sure.
What are some ways that we can differentiate or see the difference between a bad latch when a parent's breastfeeding or something that's more of a structural issue like a tongue tie?
I'll let you do that one first because you see them. You get a lot of the early kind of breastfeeding tongue tie
Yeah.
cases. I get
So
the later ones.
you're talking about Bailey, like how would a person tell the difference between just a latch being poor versus the
Hmm.
baby having a tie where it's the mechanics
Right.
that's make
Right.
a lot of times I'll tell moms, I'll ask them how it feels. Now I will admit that even with babies that are tied, usually if I'm coming in and helping them latch when it's been uncomfortable, usually you can still get a comfortable latch. Sometimes it's always going to be painful, but I would say that that is the exception to the rule. It might not be consistent, but you can get it. But I'll ask moms, what does the pain feel like? Sometimes if you have moms that are breastfeeding pretty well and everything is going smoothly early on, just everything is not perfect. The baby might doze during a feed, or the positioning might be a little bit off. Maybe we start getting a little bit too much pressure on the nipple tip that will contribute to some initial soreness. But usually when you have babies that have very dysfunctional sucking, that's going to lend itself to more damage and maybe more pain or discomfort than you would ordinarily see. The other thing I would tell moms to look out for is, what is the nipple shape when it comes out of the mouth, you know? A lot of times I think it's confusing for moms that have babies that are tied because they go to the hospital and they have the baby. And a lot of times staff will look at the mom latch and they'll say, oh my gosh, the latch looks great. The latch looks beautiful. And it can look good from the outside. But if the mechanics of what the baby is doing in the inside of the mouth are
Hmm.
wonky, you're still going to start to get pressure on that nipple, or they're going to do funny things where that nipple is going to come out of the mouth misshapen. Um, or you're going to get ridges on the nipple tip, or you're more likely to get cracks or things like that that pop up. So that's what I would be looking out for. Also, just signs that the baby is not draining the breast well. If I have a baby that's not gaining weight appropriately and the mom doesn't have any red flags that there would be any indication that she might have difficulty with her production, but this mom is getting plugs, this mom has had mastitis, this baby has had jaundice. This baby took too long to regain their birth weight, or they're not, staying on their growth curve. We're looking at those things too.
Yeah.
And sometimes even I'll get the babies who kind of, like Leah said, like they had the tongue tie, but they were able to compensate,
Hmm.
right? And then I get them whether it's at 4 months because the supply has dipped or the weight has dipped, and parents are trying to figure out why, or anecdotally more so, your transition to solids are now becoming problematic. And we're seeing a lot of that. And with that, I'm always trialing therapy first to see if we
Hmm.
can, if the tongue tie is truly impacting the oral motor movements and the function.
Hmm.
Some of my babies, even with tongue ties, they learn how to eat and they transition to solids. And they do great, and their speech is coming in, and we just are kind of like, you know what? We're not going to mess up a good thing.
Mm-hmm.
Even with some of my bottle aversion babies, I get a lot of
Hmm.
those, and that really spikes for me at 4 or 5 months because the sucking reflex has been integrated by then. Your sucking
Yeah.
reflex is integrated around 8 weeks. So if you're planning to go back to work, you should have been introducing a bottle
Hmm.
consistently by, I say 4 to 5 weeks. I don't know what you see, Leah, but like
I say, if everything is going smooth, I'll say 4 weeks. Based on the scenario, sometimes I'll push it to 5.
well,
I'm
like
not trying to push it out to
don't
six or
go to
seven.
6. No, you
Yeah,
crazy.
I'm
And
not
then
trying to push
also
it out to 6 or
no,
7.
and even if you give the bottle at 4 or 5 weeks, like please be consistent. Like a bottle a week is not going to do that unless if you truly don't want to go back to work, then you do you,
But and
right?
I'll get moms too. Like I saw a mom recently and she wants to exclusively breastfeed. Now, I will say most moms when they say they want to exclusively breastfeed, they don't really mean exclusive breastfeeding. They mean exclusively breast milk fed. So, but she's kind of like, I'm unsure. And it's like, look, if you're not planning on being with this baby 24 hours a day, 7 days a week forever, if you think there might be any moment where you might need to do a bottle, we should go ahead and introduce it, and we should keep it in with a certain level of regularity just so you're not having to deal with that stressor when they get older, because it's hard to reason with an 8 week old baby. It's just they don't, I mean,
No, and I mean, and we both get those consults too of, oh my God, I'm going back to work next week and my baby doesn't take a bottle. And I'm like, oh my God, like that's so stressful,
it's
you know.
so stressful. It's so and I think a lot of people think that because they gave the baby a bottle and it went well when the baby was 2 or 3 weeks old, that the pressure is off, and so now we can just, we don't have to worry about it. We know that they'll take it, and then you start taking long breaks and it's not in there regularly, and then when they revisit it, that's when they realize that there's a problem. That happens too.
But now related to like the oral motor function or the tongue tie, sometimes I'll see babies that the breastfeeding is going well and the bottle feeding, like they've just learned how to compensate or what I call ride the letdown of the breast,
Hmm.
the letdown. So their sucking mechanics have never really gotten very good. they just kind of get water hosed and they're thriving on it. But then when we introduce the bottle, they can't use the water hose anymore. It
Mm-hmm.
doesn't work that way. You actually have to suck on the bottle and you have to latch and you have to work a little bit. And, my first line of defense is not to do a tongue tie release, but sometimes I'll notice the tongue tie or I'll notice body tension or tightness.
Mm-hmm.
And we kind of have to work through that and come up with a game plan to figure out like, okay, if these therapeutic techniques don't work in XYZ time frame, do we then visit the tongue tie release? And
No,
if
it's true.
and
Yeah.
if we do, I'm here to support you. And I know you're there.
Yeah. I think what you're going to see a lot is that when you have babies that have like not a strong skill set, it just becomes a lot more difficult for them to toggle back and forth and do a lot of different things. So, like what you're saying, we might be on the breast really well, but now we're struggling with the bottle. We might be good on the bottle, but now we're having difficulty on the breast. Or it's hard for them to be able to do both well simultaneously without regressing in one area or the other. But yeah, a lot of this is just looking at that individual family and that baby and that mom and seeing where they're at and coming up with a game plan that's going to be good for them. I had a
Mhm.
mom recently where the baby wasn't taking a bottle and she was asking, like, I mean, like, is there any sucking issues here? Are there any ties or anything like that? And it was one of those scenarios where, well, it's not perfect, but I think it's good enough your baby can take a bottle. If we do these things, I think that it will work. And let's see, let's start here and then take it from there. So yeah.
Did you get the baby to take the bottle?
Yeah, I'm gonna check in with her today, but I don't but I yeah, it's not, it's like you said, Jean, everything doesn't always have to be A plus plus to be able to kind of, get some of those things under your belt. So
Well,
yeah.
and even when I have exclusive bottle feeders, especially with all my years working in the hospital, like some of them are functional. It's not optimal, it's not perfect, and some babies are just really not good bottle feeders, just like breastfeeders, but it's a period of life.
Hmm.
Like, you might be the mom who breastfeeds your baby until they're 18, but more often than not, you're going to probably stop the bottle and breast, anywhere between 12 and 18 months of age. And
Hmm.
so for many times we kind of weigh the pros and cons and we talk about it and we're like, we're functional.
Hmm.
As soon as your baby hits 6 months, we are going to be eating and drinking out of a straw and doing all the
All
things.
the
And so I feel like, and I don't know how much of like social media impacts this. Of course, it impacts a lot of people's lives. But we just kind of have to know that not everybody is perfect at everything that we do. And it's a journey.
hmm.
Um, and that oftentimes like we're not jumping to a tongue tie release I am not looking for the quick fix. I
Hmm.
want to know the root causes, but I also want to like work through them in an
And that
appropriate manner.
goes back to what you were saying, Jean, about wanting to do the follow up, because a lot of these plans that you come up with, it's evolving, it's changing, depending on where you are, what skills you kind of get under your belt as the baby grows older, where they are, what things are changing. You have to just keep working with them to kind of get to where it is that you need to be for that stage that they're in at the moment. So
Mhm.
yeah.
Yeah.
Yeah. What are some changes that you've seen in babies who do get early, consistent care versus not?
In general, I would say things, everybody is a little bit different. Some scenarios are more complicated than others. But when you're able to get that early, consistent care and you're starting out on a pretty strong foundation in terms of having good education and support, parents are typically not having to invest as much work and effort. And I would say overall stress levels are lower. I think it's easier for them to get to their end goal without as much hoopla as when you're waiting, kind of approaching things a little bit later on. it can be a lot more difficult, a lot more complicated with time.
You know, building upon that, Leah, more often than not, we get the parents that say, I knew something was wrong. I didn't know what to do. My pediatrician said they were gaining weight, but I'm in so much pain, or this is so stressful. And, you know, my doctor says, it's okay, keep doing what you're doing. And so, you know, I always tell parents, I'm like, you don't need a doctor's permission to see
Yeah.
me. You don't need a doctor's permission to see you.
Yeah.
Like, we are available. We're available all the time. I'm always making myself readily available. Trust your gut.
Yeah.
If your mama
Yeah.
gut says something is not right, early intervention works.
That's
Because
what yeah.
I don't want to see your 3-year-old who doesn't eat well. I would much rather see your baby when they're 3 months or 6 months and start on the right foot and then do periodic, you know, visits to make
Yeah.
sure things are running smoothly.
Yeah, maintenance. No, I agree. Moms have a gut, and I always say trust your gut. If something is seeming awry, seek out the help that you feel like you need. Worst case scenario, maybe everything is okay. That's not bad. But if it's something where you're just overriding that gut feeling, and then at some point it does start to get more complicated and you have to address it, well, that's very different. That's a lot more complicated. So I would say always, if uncertain, always seek out the help.
And if you find someone that you go to seek help and your mommy gut says, you know, I don't think that was the right provider, find another one. Like, I'm not going to connect with every single person eye to eye. You know, my style might not work for you. My style might work for you. It depends, but it's okay to get a second opinion as well because we don't all have the same training. We don't have the same background. We don't all have the same style either. And I tell parents all the time, like, if you've already seen a speech pathologist, I will not charge you again for an eval. I will take that eval. I'll have to do it on my own, but I'm not going to charge you for another eval because you're trying, you know, and I want parents to just, you know, it's just putting in that initial effort so that we can be successful.
Absolutely. Yeah, everyone isn't for everyone, but yeah.
But early intervention, you know, those babies tend to eat better.
Yeah,
And
I
through
always, hmm
throughout, right? Even if you see me for a baby led weaning consult, more often than not, if you as a family have good habits, your baby's going to thrive.
hmm
But
yeah.
also, like, if your family doesn't have good eating habits, then I can't change the entire dynamic.
Yeah.
You can't just go
The
in here and change everything, Jean. What?
I mean, I can if I come
just
over
do the
every
magic
day.
wand.
Yeah, I have to come over every day and nanny 911 everybody, but like I can't do that. So, but I can get you off on the right path,
For sure.
Hmm.
For sure.
and then you do with that what you want.
Fair.
The last question that we have from one of the parents was, what should parents look for when they're choosing a feeding provider?
You want to go, Jean?
um,
I feel like you touched on some of these things. You were talking
Hmm.
about everyone isn't for everyone. I feel like it's a very vulnerable time. A lot is happening. I think your comfort level is huge. So you need someone that you feel like you can, really be transparent with and communicate with without judgment so that you can give them the information that they need to put you in a position to receive what you need to get you as close to your goal as you can as quickly as possible. So I would say, someone that you're feeling comfortable with, and also going back to what Jean says, that has a good skill set in the area that you need help with. Everybody is a little bit different, and I tell this to moms all the time. I'll work with moms and they'll say, I'm doing this, and I'm like, oh my gosh, that's amazing. Where did you hear that? And they'll say, oh, I saw this on TikTok, and it's like, okay. And then I'll have the next mom and she'll say, oh, I'm doing this, and it's like, oh God, that's awful. That's terrible advice. Like, who told you? And they'll say, oh, I got it off of TikTok. I mean, it's like filled with the good, bad, and the ugly. But a lot of times when you're
Hmm.
hearing information, it doesn't mean that it's all 100% bad. For a different person in a different scenario, that might be appropriate, right? So you just need someone that has a really strong skill set in the area that you need, that you feel comfortable with, that you can work with continuously until you get to where it is that you need to be.
You know,
I love
for me
that.
to build off of that, like Leah and I both present a lot. And so, because we're passionate about what we do, we want to share our knowledge and our skill set. I am always doing more trainings to further my knowledge, be up to date on the research. I present on the research. I have previously done research of my own, and that's important for me as a clinician, but also I personally value being a more holistic provider, because even with my nutrition background, um, like Leah said, there's so much misinformation that we learn, and knowing the up to date real knowledge is important for our parents. But I do feel like a lot of the population I see, they do want more of a holistic whole body approach.
Hmm.
They are willing to buy into that, and they are very grateful that I have the knowledge about it,
Yeah.
right? So like I will know when I'm overstepping my boundaries, and that you need to be referred to someone else to help you with XYZ. And and as many people know, I'm going to let you know that.
Hmm.
Yeah.
I'm not going to hide it. I'm a direct person. I'm not going to sugarcoat things, because again, we want the best. And I don't want I want we I don't want to waste time either. The time is so valuable for these babies and the
Yeah.
parents, the caregivers. Like the time life of a baby is only 1 year.
They change so quick,
Ugh, and
so
it's such a
quick.
beautiful process. And I just want you to enjoy it and love your little
That's the
snuggly
thing,
bum.
Jean, because if you are stressed out, you blink and that baby is already older. You haven't even been able to really fully enjoy the process. And sometimes I'll get moms and they'll come to me and they'll say, well, I thought I wanted to breastfeed, but this is, you know, I need to pivot, right? Like this isn't working for me. And it's like I totally get it, because if you get so wrapped up and so stressed up, I mean, how sad is that to kind of blink and look up and the kid is completely different, and you weren't able to be fully present because, you know,
One
you're
reason or
worried
another.
about
Yeah.
XYZ. Right, right.
I know. I know. They get so big. So that's kind of, yeah, why, I mean, that's kind of going back to that early intervention, but also why I love what I do, and
Hmm.
why it's important to find a provider that fits, that kind of checks your boxes a little bit.
For sure,
Yeah.
for sure.
Mhm.
I remember when Piper started OT, that initial visit was started by the therapist saying, "Hey, this is an interview. This is not, we are not doing anything. We are meeting each other and we are seeing, can I offer what you are needing? And can I can I meet the need? And do we mesh well?" It's not a, can I just meet the need and okay, I've got the skill set, we're going with it. But this is a huge choice as a family to go forward with occupational therapy for a child. Am I the right fit for you?
Right.
And
And that's
having
why
that
I
very
love my
transparent at the beginning.
prenatals too. That's why I love my prenatal consultations too. You just kind of get to meet each other, talk with each other, figure out what the other person is like, build that comfort level and see like, okay, does it seem like a good
Yeah.
fit? Does it seem like it's going to work? Absolutely. Oh, that's good, Bailey.
I know.
Well, yeah, I mean, I know you guys have that same mentality of, hey, if we don't mesh, no hard feelings. You as a patient deserve a provider that is going to meet your need and that you do mesh well with.
For
Yeah.
sure.
We are just under different, like, tighter time constraints sometimes.
It's true.
Yeah.
It's
And so there's a little bit of like walking on eggshells because of the value of this tiny human
Yeah.
that we're trying to help.
no, I
But
get what you're saying. Yeah,
but
Jean.
I do
Hmm.
love that. I mean, but that was my big reason why I wanted to do my private practice, right? Like because now I get to do what I love to do. I don't have to I could manage myself. And
Hmm.
if a parent wants to work with me, amazing. Like, yes, let's do it. And if a parent says, we're not a good fit, that's okay too. I will provide you with other recommendations that I think would fit the personality better
Hmm.
or the goals.
Yeah.
No harm
Hmm.
done. Just give me a good Google review.
But we were talking about that the other day, though, Jean, too. Like how ultimately our goal is like you just want to see that the parents and the babies are okay. And
Yes.
sometimes I think moms are in a situation where they're having to juggle so much. Women in our culture and society, the pressure is unreal. You're managing
Hmm.
work, you're managing the house, you're now you have this new baby, and a lot of that largely falls on their shoulders. So it's a lot of pressure on them. And sometimes I think with all of that pressure, moms can get concerned that they're going to be judged for what it is that they say or, doing what it is that they want to do because maybe someone has said that isn't the appropriate thing to do. Or they feel like they're going to get, judged if their baby is doing XYZ instead of ABC. So it's a hard space to navigate.
Yeah.
But
I think,
Gene and I don't care about any of that. We just want you to say what you want to do and where you are because the more information we have, that's how we can best help you. And I think that was kind of what
Yeah.
our conversation was. Like, we just want them to be okay. We just want them to have what they need to be well.
and
Hmm.
like my other love of the process is that a parent chimes in every few weeks and they're like, "Hey, I know you didn't ask for this update, but I want to let you know Johnny is like doing amazing."
Hmm.
And and I hope I'm not bothering you. I'm like, "Please, never ever ever think you're bothering me because those are my favorite text
And the
messages."
pictures. I
Oh
get
my
I get
god.
the
Like
pictures and
I
they're
love it.
older and the emails and it's like, okay, yeah, that's the best. It makes my day every time. And I'll tell the moms that like, oh, this totally made my day. This is fantastic.
It is. Yeah. Yeah. Well, I'm glad we could do this.
Yeah, this was
Yeah.
great.
Thank you, Leah. I love it.
Absolutely. Absolutely. Thank you, ladies.
So, but yeah, I mean, for both of us, um, like I said, we said earlier, I'm with Little Eaters and Talkers and work at West U. And Leah, you're
SOS Lactation, and I'm at Westview 1 day a week and Tanglewood 1 day a week.
so
And we love all the time that we get with both of you.
thanks,
Wonderful. We do too.
Kelly.
Appreciate
Awesome.
it.
Well, thank you guys both for getting on. I appreciate it. And
Yeah.
then any questions that a parent has or any input, always feel free to leave it in a comment or message any one of us directly or give the office a call.
Sounds
Awesome.
Cool.
great.
Thank
You ladies
you.
enjoy
All
the
right.
rest of your
Thanks,
day.
guys. You too.
Bye.
Bye.